Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have real power and real control, so that you can influence decision making, even if you're not a doctor or a nurse in intensive care. In last week's blog, I was telling you about what questions you need to ask the most senior doctor in intensive care if your loved one is critically ill. You can read, watch or listen to the blog if you click on this link. In this week's blog, I want to show you the 6 phrases you should never say when your loved one is critically ill in intensive care. Your mindset is absolutely critical when your loved one is critically ill in intensive care, and it's often the only thing that you can directly control, and it can make all the difference to get you, your family and your critically ill loved one through the challenge of being critically ill in intensive care. A negative mindset and negative thinking gets you away from what you want, and it also diminishes your level of power, control and influence that you need whilst your loved one is critically ill in intensive care. On the other hand, a positive mindset is crucial for your level of control, power and influence whilst your loved one is critically ill in intensive care. Therefore, you need to know what to do in order to stay not only positive, but you also need to know how to avoid negative thinking and negative framing of the situation that you, your family and your critically ill loved one are in. In more than 15 years intensive care nursing, I have accompanied and supported dozens of families of critically ill patients in intensive care, and I have seen that negative thinking is often prevalent, and with that negative thinking there are often phrases or sayings that families use that directly impact on their level of power, control and influence they have while their loved one is critically ill in intensive care. So let's look at those 6 phrases, why you shouldn't use them and what you need to do instead. Number 1. I'm giving up hope. I'm giving up, or I'm giving up hope, is one of the worst things that you can say or think. I know that the situation of having a loved one critically ill in intensive care is really devastating and frightening, but giving up is the worst thing that you can do. Winning against the odds often starts with your belief of beating the odds, and giving up or giving up hope is not part of beating the odds. This is even more important if the intensive care team is painting a negative and grim doom and gloom picture for your critically ill loved one that you shouldn't buy into. You should always question the intensive care team's motives for their positioning of your loved one's prognosis and diagnosis. The intensive care team may in fact give up, or they may not have the patience, or they don't want to invest the resources, and they don't want to do whatever it takes in order to get your critically ill loved one through this challenge. Number 2. I think we're not getting what we want. This is another big challenge and another phrase that you must never use whilst your loved one is critically ill in intensive care. One of the most important mindsets you need to adopt whilst your loved one is critically ill in intensive care is your belief about that you can get and will get what you want. As a rule of thumb, you should always question the intensive care team's positioning, their motives, and the things they are saying and they are not saying whilst your loved one is critically ill in intensive care. Your belief that you can achieve what you want in this difficult situation is making all the difference, and it will challenge the intensive care team if you exercise that belief. After all, the intensive care team has its own agenda, and that agenda is often dependent on the moving parts in the background of an intensive care unit, and those moving parts are mainly the politics, the financial budget and other admissions awaiting an ICU bed. Number 3. I think I can't control the situation. Again, one of the biggest challenges in intensive care is that families of critically ill patients feel that they have no control, no power, and that they can't influence decision making. Nothing could be further from the truth, and you can and will have control, power and influence if you believe that you can, know what to do, know what questions to ask, know about the moving parts in intensive care, know that the intensive care team doesn't always act in the best interest of your critically ill loved one. armed with that knowledge, you will be able to control your and your loved one's destiny, and you will have power and influence. Number 4. I think I don't have any power. Families of critically ill patients often feel powerless, and they often feel intimidated by the doctors and the nurses in intensive care. Stop feeling powerless and stop feeling intimidated by the doctors and the nurses in intensive care. After all, they are only human too. The more research you do regarding the critical illness of your loved one, and the more awareness you have about what's happening behind the scenes in intensive care, the more power you will have. Number 5. I don't think I can influence the outcome. Having a loved one critically ill in intensive care is often a devastating experience, especially if your loved one has a poor prognosis, is a long-term patient, or if you have been told that your loved one may not survive their ordeal in intensive care. If that's the positioning of the intensive care team, you need to question why they have positioned themselves that way. Is it because they have a negative mindset? Is it because they don't have the patience? Is it because they don't want to invest precious resources into your critically ill loved one's recovery? Is it because they have other patients awaiting admission into intensive care and they need the bed? The more you know and the more questions you ask, the more influence you will have, and the more you will be in charge of your own destiny. Number 6. But the doctor, the intensive care team said. This is probably one of the worst statements that families of critically ill patients can make, and if families make that statement, it often shows that they are intimidated by the intensive care team. And it often shows that you feel powerless, out of control, and without influence. But how do you get to that all-important feeling of power, control, and influence? Well, you'll get to that all-important feeling of control, power, and influence if you enter your email below and you sign up and download your free instant impact report now. In your free instant impact report, you learn quickly how to get real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Our free reports help you with in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up for your free membership and download your free instant impact report now by entering your email below. In your free instant impact report, you'll learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free reports, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to control, power, and influence in your situation. You'll get crucial, behind the scenes insight so that you understand what is really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. With your free instant impact report, you'll also get 4 other free reports, and the reports you will be receiving are the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you are not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, 9 myths of being a critically ill patient in intensive care. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.